Alrighty, good morning, good morning. Hope you guys all are well, bright and fresh faced, looking like an amazing crowd. My name's Will, as was just said, but really excited to be here. I've done a few of these from day one conferences now, and it's like I always learn a ton. I get good story ideas, so appreciate all you panelists for joining us and feeding my future benefits and healthcare coverage. And my really only strategy myself for my own well-being is just getting away from my children, so which is probably not like a good long-term strategy. So I'm really excited to hear all the amazing things our panel has to say this morning. So we're going to start by I'm just going to ask each of you to introduce yourself, tell a little bit about what you do and how you sustain your own well-being, especially when work gets heavy. So we'll start with you, Michelle.
So people ask me what I do, and instead of answering the question like a normal person, I say that I'm some superhero, like Wonder Woman, Superman, something along those lines, because I'm constantly looking for ways to make people's lives better. And that directly connects to the topic today. I'm a mom of 4, ranging from 4 to 22. We'll talk about that later. And I absolutely love what I do as a director of diversity and inclusion at a healthcare organization.
Yeah, I love that. Actually, that's amazing. So I'm Hope Gladney, and I feel too that everyone has an individual superpower. So what I do at my organization is I have a responsibility to grow our business and also a responsibility to make sure that the customers that are deploying our solutions, that they have success with that. And I am also a mom of, I call our family the Brady Bunch because we have a blended family and there are 3 boys and 3 girls. And so for me, some of the things that I like to do when I'm feeling a little bit stressed, I've created a consistent routine for myself, so I try to work out every day. But I am a fan of mindful breaks where when things get too heavy, I will take a walk. I will go outside. I'll do anything. And then lastly, music. I mean, it's so good for the soul. So I'll blast some music just to get away from things and to relieve the pressure.
Have a little dance party.
For sure.
Love that. Hi, everyone. My name is Elena Gambon. I'm with First Stop Health. My job there is to help grow the company, hire the right people. We do a lot of product strategy work, dealing and supporting our customers. I am coming to you from California, so in true San Francisco fashion, my break when I get stressed is to make sourdough bread. I find that what's really nice about it is when we are in this world of sort of sitting down at a computer, staring at a screen all day, it's really nice to get tactile, like having a dance break or making something with your hands and seeing that build and grow in front of you. And it is a mindful break in a way. So I'm a bread baker.
Good morning. My name is Dennie, Laney. And as of 2 weeks ago yesterday, I am no longer at Associa. So shameless plug, I'm available. So one thing that I've done for my well-being is my husband and I are leaning plant-based since January. And I'm not categorizing myself as anything. I'm just leaning more towards plant-based living, which has been working out really well. Feels good. I'm the best dog mom on the planet of 1, and I'm the best of a lot of things, I guess. And I'm also the best aunt on the planet of 7 great nieces and nephews. So they're my world and my life. Forget about their parents now. They're old and I don't care about them anymore.
Good morning. I'm Greg Miller. I'm with AccentCare. We're a large home health company across 30 states, and I have a variety of other duties as assigned. And really, I was a benefit of a wellness program back in 2009 when I was with Concentra, and I lost about 75 pounds in that program, started to run, because terrified that I might gain it back. And since that time, I've run 3 full marathons and about 25 half marathons. So that's and it really was because of that I got into running. So when things get stressful, I run.
All right. Thank you guys so much. So yeah, that's easy. Just convince your employees to run 25 marathons, and so they'll all say yes. Problem solved. No, it's amazing. Amazing story. Can't wait to hear more from all of you guys. We're going to start with you, Dennie, on this question. As HR professionals, you're used to responding to crises, but we want to hear from you and maybe Greg and others about tools and techniques that employers can give to workers in advance for more holistic, preventative approach to stress and related issues. Can you talk about that?
I attended a conference in February, and there was so much conversation about supplementing your benefit stack. And coming from my whole career through hospitality and community management, that's expensive. And so one of the things that we've encouraged is the people who are going to be asked or told that they're burnt out. I feel like so many leaders, I'm just going to call them people leaders, doesn't matter what level they're at, aren't equipped to have the conversation. I don't think that we've crossed the threshold. We've given so much permission to say I'm overwhelmed or I'm worried about my well-being or my workload, yet have we equipped the people that have to handle that? Because you can't fix it. And, as leaders, typically that's what we want to do is you listen to their problem and then you fix it. And this is not something that you can ever fix. So what are the tools and techniques that you're giving to your people leaders so that they can be better equipped to help those that need that?
Yeah, good thought.
Yeah, I think healthcare it's just a really tough industry when you think about stress because our caregivers, our clinicians, their whole job is about caring for others. And in home health, it makes it even more challenging because, no one is coming into a building, other than about 10% of our staff that is back office. And so we have staff that is out in homes. And so God knows what they're going to face out in different people's home. We have a large business in Mississippi, and part of our orientation is, do you like animals in the house? We've had employees who people have, committed suicide in front of them in their homes. We've had, a variety of other things that happen and different things that people say in the privacy of their homes that they probably wouldn't in a hospital elsewhere. And so I echo a little bit about what Dennie said is we've worked really hard to equip our leaders. We've also established a number of we call it office hours, but places where our employees can call in because they can't walk from the patient to a nurse station or a patient to their boss. They walk to their car and they're sitting there having to deal with whatever they saw. And so we've tried to provide the infrastructure within our organization to support them when they need it and really give them what we call a license to call for help. And to leverage the resources we have. It's not perfect. It's probably our biggest challenge, but we're making inroads into it.
Yeah, good point. Anyone else have anything to add on that? No? All right. My mother was a long-time home health nurse as well, and traffic, another big stressor for those folks. And I think she dealt with it, if I remember correctly, by I think she started taking care of a feral cat colony. Which she still does today. So another hot tip from the moderator, something to think about. So this next one's we're going to start with Elena on this one. So companies offer a cornucopia of benefits in all different directions, wellness resources, but as it's kind of already been brought up, sometimes those things aren't utilized as much as we would like to see them. What have you learned about leveraging resources and increasing engagement? Teach us how you can get some success there.
Yeah, happy to share. And I am a fellow cat mom, so I can understand and empathize with your mom. So First Stop Health is virtual care across counseling, primary care, urgent care, and navigation. And I'll give you a statistic so you know I'm speaking with a little bit of credibility, which is our average utilization is about 60%. And that is an extremely intentional thing. So what we've learned is that two things have to be true for a benefit to be used. Number one, the benefit itself has to be designed in a revenue model perspective such that it is intended to be used. Meaning, the company has to be incentivized for your employees to use them as much as they possibly can, either through how you're paying them or through a contractual guarantee, or through their own internal business model perspectives. If the company has a business model where they make more money when less people use it, it will not get used. And so I ask you just to spend time with any vendor that you partner with to understand the basics of how their business operates and to uncover opportunities to make sure that that's true for you. The second thing I'll say is that we have to focus on the science of behavior change. Is anybody here familiar with BJ Fogg? He's a behavioral economist. I saw a couple of head nods. So we're big nerds at First Stop Health, and we use his model to explain how we operate. And BJ Fogg says that you need 3 things for someone to take action. The first thing is they need motivation. So the pain or the pleasure to act has to be high enough for someone to actually make a change. The second is the ability needs to be there. And for us, that means the service needs to cost $0 for the patient. The time that it takes a patient to get to talk to one of our doctors needs to be minutes, not hours, not days. The ease of use of the technology needs to be there. The third prong of that stool is prompting. So if you are not constantly reminding people that you exist in ways that resonate with them and in creative ways and in a non-one-size-fits-all manner, no one will remember that it's there, and it's not their fault. We're constantly bombarded with information. So all 3 of those things have to be part of the solution, and your partner has to be incentivized to get you there and to help get you there. So that's what we've tried to employ, and I'm hoping you can kind of take those learnings more broadly and talk to any partner that you have and see if those are applicable as well.
Great insight. Greg, anything to add on that one?
No, I think it's this whole notion of flexibility, and I like the idea of prompting. What I find, and I don't know if your organizations are the same, is we all talk a big game on wellness. We all talk about flexibility. But when push comes to shove, that's one of the first things that gets sacrificed, right? Like post-COVID, we were all about flexibility in the work environment, working from home, remote, and nearly everybody I talk to now is back in the office 3, 4, and some even 5 days a week, dealing with the stress of traffic, et cetera. And it's this still antiquated belief that work is done when I see you. It's not done elsewhere. And I think it's the real challenge for us and others, I think, is how do you really tie these wellness and this flexibility to tangible business results in ways in which we can talk about them as retention drivers, as attraction drivers. Your prompting is spot on, which is, I think when we fail the most, at least personally, is when I forget to sell it. When I'm administrating it and managing it and not constantly reminding my peers on the executive team that says, this is the reason we're doing that. And it's easy for that to slip back, I think.
Yeah, great point.
Yeah, I would think too. So I work for a company that provides leadership coaching. One of the benefits that we have is each employee has access to that. But I think to improve the engagement on it, as you say, is to we have to really meet the individuals where they are. So a lot of these programs really need to be done within the flow of work. So I think we really need to understand what it is that each individual needs and try to tailor, benefits and things that are actually going to meet them in the area where they're going to achieve the most benefit for them personally, but also benefit for them as to how it's going to relate to the overall success of the organization.
Yeah, great point. Yeah, the flexibility is huge. My boss thinks I'm at work right now, so there's some flexibility. I'm just kidding. She knows. She's going to be here later. Her name's Christine. This one's gonna start with hope on this one. Your company helps organizations build and grow capacity in the workforce. How does a culture of wellness contribute to that process, specifically when applied to a team mindset?
Yeah, I love this because many times we do coaching. So when you think about coaching, you think about it at an individual level, but so much of what we do in the course of work is done from a team level. So we're engaging teams now, and the way that we engage these teams is to really understand, what is their North Star? What is it that, what does success look like for that team? So as we're talking to them, we want to understand, the individual perspectives that they have, but we also want to understand, how do you operate as a team? A good example of it is that you have an orchestra. Everyone plays an individual instrument. My son was in orchestra. He played the violin. But then you have the bass player, the cello. They don't know much about the other instruments. So where these teams come together, that's the symphony. So where are the tools and what are the things that we have that we can give to these teams so that they're engaging as, a symphony, that they're working together harmoniously? And one of the benefits to working from a team perspective is that you're able to really scale out these capabilities a lot quicker than you would as opposed to just meeting each individual. So I think there's a few different ways that you can deploy it, but it's really understanding what the team is driving for.
Sure. Dennie, do you have anything you've learned about how teams, wellness amongst teams can make them more productive?
I think that it's just kind of part of the culture. I think that if it's part of the conversation, kind of to the awareness and how are we supporting each other and, working together, that would be one thing I would say, as leaders, is intentionally making these conversations a part of the conversation. It's not going to go away. It's not just a thing. It's not just trending. So really thinking through as a leader, how do you want to incorporate building that conversation to start to feel more organic?
Mm-hmm. Yeah, good point. Yeah, I know whenever I'm leading a team, I feel like I can get quickly locked into delegation, complete the task, let's go, rather than checking in on the folks and, are you doing what we're doing good, we're doing all right.
Because you can see when they're not.
Yeah. Pardon?
It's very easy to see when they're not okay.
Sure.
I mean, if you're really looking, it's not as if, we don't really fake it anymore given the permissions that we've been given to speak freely about that. So just ask, I don't get the feeling that you're okay right now. Do you want to talk about it? You don't have to, but.
Yeah, because it's important to create that psychological safety.
Correct.
So that they're okay.
Correct.
With saying that they're not okay.
Right. Mm-hmm. And you being okay with them not being okay. That's the hardest part.
Yeah. A culture of vulnerability can go far. Greg, we're going to start with you on this question. You already mentioned sort of how the healthcare industry can have specific challenges related to wellness, especially given intense schedules and home health and people homes and some of the things you talked about earlier. Tell us about how you make sure that your staff feels supported, feels cared for, especially those folks in the homes that are kind of on the front lines.
Yeah, part of COVID really was a massive impact on clinicians, nurses, LVNs, therapists, right? Which is, the hospitals had to move folks out of the hospital as quick as they could with COVID, out to homes to make space for the sicker folks, which was understandable. And our employees took care of a lot of COVID patients over those 2 years. And, I did ride-alongs with folks and listened to some of what they were stressed about and what they were dealing with. And, we would have clinicians that would come home, right? And this was at the height of the fear of COVID, who would strip naked in their garage, throw everything into a garbage bag, throw it away, and then go immediately into a shower, and were still terrified they were giving their family COVID. And so, and a lot of people left the industry. And because of that, I think what we have tried to do, I think, within healthcare is, and others have already said it, which is create the space to say, I'm not okay and I am scared and I need some help. We've tried to better leverage the resources we already had in place, employee assistance programs. We have a very robust employee assistance fund, which we pay for different things for employees who are suffering or struggling, et cetera. We try to provide a lot of space for our hospice nurses. We have about 600 patients who die every week on our care that our nurses deal with. The last piece, I think, for healthcare is it's easy to get singularly focused about health wellness. And we've really tried to broaden that out to, spiritual wellness, financial wellness, in thinking about it more broadly, because a lot of times it all combines, right? Which is, I've got stresses at work, but the stresses are magnified because I'm struggling with inflation going up and my pay not increasing commensurate with that. I'm stressing because I've got family issues, and then I've got to spend all day long caring about people and giving more to people to try to create that space. So a few things we're trying to do, but healthcare is difficult because, the patient, we have to go to the patient, and people don't die on 9 to 5, clocks. So we have to have, caregivers that are willing to go out Saturday in the middle of the night to help a family grieve through the passing of a loved one. And so I keep saying it, but I got more questions than I have answers in this space.
Yeah, super difficult. And the social determinants of health can be really huge, as you mentioned. Elena, you are also in the healthcare field. Do you have anything to add as far as supporting those frontline folks?
Yes, so we employ nurses and physicians and health coaches. I think your team is dealing with some pretty intense, high acuity stuff, very emotional. And the word caregiver is an interesting one, because what we've just chatted about is caregiver as a profession, but there's also this concept of a non-paid caregiver, all of this unpaid labor that predominantly female identifying individuals, but not always, do in the home, whether it's to care for a neighbor or a family member or an aging parent or their own kiddos who are well or special needs. There's a full spectrum of caregiving that is happening invisibly behind the scenes with almost every single employee. And so one of the things we think about is, what can you do for them? And an interesting concept, besides every smart idea that's been said so far, is how do you make sure that anything you provide to your employees across the board is not only equitable, but available to all members of the family, however the employee defines family. So that might be, you've got an employee who relies on their neighbor to watch the kids while they're at work. And you better believe that that neighbor is a part of their household. So how can you support that extension? And so what we try and do is make our services available to this sort of broad variety and definition of family. And that service set is mental health counseling, care coordination, primary care. It runs the spectrum, but the sort of umbrella concept here is thinking of your employees as doing this invisible labor beyond what they're giving to you, and how to support them through that, which is a big deal.
Yeah, it's a great point. Really redefining what the household looks like and that sort of thing can be really important. Michelle, this next one is for you. As a DEI leader, you're focused on efforts to help increase workplace diversity, equity, inclusion, and belonging. How have you seen leaders create deeper connectivity by fostering a sense of belonging and inclusion through workplace well-being?
It's simple. How many of you go places you don't like? Put your hand down. Don't go back to those places. Nobody wants to frequent a place that they don't feel valued, welcomed. It's an enjoyable space. If it's freezing in your house, I'm probably not going to come very often. But if you say, hey, I've got a blanket over here, I've got some popcorn, I'm there. So we've got to get back to the basics. Number one, it's about knowing what kind of organization you have. People like to say, oh, we have a culture of blank, but you accidentally created a culture of blank. So understanding truly what your culture is, and that probably takes an expert, and then determining, is that what you want? Is that where it's supposed to be? And if it's not, it takes time to move that. And as you're moving that dial, it's about doing very intentional things daily, consistently. It's about bringing people into the organization that are emotionally intelligent, stepping out of my bubble, jumping into yours, jumping back into mine, jumping into yours. It's exhausting, but emotional intelligent people train themselves to show up that way. And those are the people that you want leading and in areas of leadership responsibility, because they're going to figure out things before the average person does. And it's going to allow people to feel more welcome.
Yeah, great point. Anyone else want to add anything to?
You better add, because I'll jump in and say some more stuff.
That's okay. That's okay. Hope, we're going to start with you on this question. Many common stressors in a workplace, but every worker also has their own well-being experience. I think you touched on this earlier as far as meeting people where they are. But how can employers take an inclusive approach so that the solutions aren't just one-size-fits-all standard issue? How does that practically look in sort of individualizing those resources?
Yeah, I think just adding on to what you said, when you take an inclusive approach to it, it's first recognizing that everyone's well-being journey is uniquely theirs. There's not a cookie-cutter approach to doing this. There's just, I think that if we come from a culture of where we have this a leadership, a mindset of leadership, and so if we think about, when I think about some things that are associated with that, it's just having self-awareness, understanding, this is how I create space for myself. These are my triggers. These are the biases that I bring forward. How do I leverage that and make sure that I'm being the best that I can be? And then there's also just empathy.
Wait, that's a hand clap. Everybody get a hand clap for that. That's so important.
Yeah. And there's empathy, and so I am not the only person that's here. I need to have respect for my coworkers. I need to have respect for what their different perspectives may be, even though it's not mine. And so when you have leaders that are creating this type of environment within their organization, it actually creates, a space where people want to be authentic. They want, they're not afraid to come forward with any challenges that they have. So I think the way that, as we're talking with, within our company and even within the customers that we're talking to, it's just creating that space for everyone and just recognizing the uniqueness of the cornucopia that we have.
Sure. Yeah. Elaine, anything to add as far as just individualizing offerings or trying to have an inclusive approach to caring for your employees?
So I'll share one learning we had as it pertains to our own benefits ecosystem, which was, and you all correct me if you think you disagree, often when we think about creating inclusive benefits, we give people what we think is inclusive and we don't ask them what they want or need or feel like they would like. And so as hard as it is to invest the time and the money to listen and gather data, it is the first most important, I believe, step in creating something of value is spending the time to ask people what they value, because it's not always what you think it is. And so that sort of data gathering step, I like to say that diversity, equity, inclusion, and belonging, the D is both for diversity as well as data, because it is a science and a proven science that the more you focus on the individual, the better off they will be and you will be as an organization. So figuring out if it's a survey or a listening tour, investing funds and resources into learning is an extremely important part of that process.
Yeah. And I think having the ability to pivot once you get that, because how many times do you start something and you think this is what we're going to work towards, but once you actually do the assessment, when you actually talk to the individuals, it's a whole other area that you really need to focus on. So you have to have the ability to pivot and really meet those people where they are to really get to the root of what you're trying to do.
I completely agree.
If I could add one tiny thing. Everybody knows the golden rule, right? Treat others how you want to be treated. That is played out. It is the platinum rule. It's about treating others how they want to be treated. Mm-hmm. And you have to tap in to understand what that is.
Mm-hmm. Yeah.
Yeah, I think if you, where I find it is that the direct leader or manager trumps most of what you're doing organizationally, which is you have a variety of these initiatives, these plans, these areas, but at the end of the day, it's a relationship with the employee and their manager and what that manager says at the point in which they have a need. And I believe this through a lot of gray hairs, I guess, which is all leaders are typically good intention. Doesn't mean we have good outcomes as a function of it. And one of the places where I think we underinvest in leaders is creating the confidence of flexibility, which is, I talk to leaders and they're like, I can't do X, whatever X is, because if I do it, then I got to do it for everybody and it's chaos and no one will see patients, etc. And you go, that's just BS. Yeah, you can do that and you should have the confidence to be able to do it. And if somebody comes to you and says, well, why did you let this person do it? And then tell them. Say, I did it for these reasons, and I'd do it for you as well in a similar situation. But what happens is they get so caught up in having a process and a policy and being consistent that they go, I need the afternoon off because I just need to decompress. And they go, I can't do that because then we won't see patients every Friday afternoon. That's an intentional effort in education and culture that I think we have to create in these organizations to be able to execute on these wellness and well-being initiatives.
I think we keep coming back to the leader. And I don't know that, depending where you are in the life cycle of your organization and what the culture is like, and all the demographics and things that make up your culture, it's not an HR thing anymore. So if it's irresponsible, frankly, as a leader, to not be a student of what's going on in terms of well-being and those types of things in the workforce, because you put in your LinkedIn and it's like, because there's so many facets. How do you get your leaders to not, perhaps, depending, the proverbial eye roll, like, I don't want to talk about this, people just need to do their work, and there's still that happening, and obviously, and then the leadership education piece, and then there's all these layers and so many facets to it, but there's so much out there. Just commit to reading an article a week, and I encourage my leaders to do that, to become a student of what's happening in the workforce, specifically well-being and burnout and all of that.
Sure. Yeah, we all know the feeling of having something we're passionate about at work have support from the very top, and whatever that looks like. So that can be huge. Quick example to that. We had a company kickoff, and the way the kickoff started, our CEO, he asked, not everyone obviously, but the first question was, I want a few people to tell me what you're grateful for. And that was just such a thoughtful opening, in my opinion, because it's one of those where, he was compassionate, but he really cared about, what we were thinking in that moment. So I think just to create space, just to, have empathy and compassion and to really understand where your people are. Yeah, great point. And another tip would be to just watch and apply the movie Inception, and then do that to your CEO and incept some ideas about wellness and well-being and see how that works. And then it'll be their idea, and then it'll get all the support. So it's great. Yeah. So we're going to come back to you, Dennie. You've worked for a company that spans the country, thousands of employees. I imagine a lot of our audience are in similar organizations. Talk us through some of the challenges of what building a culture of well-being looks like in a large organization like that, where you've seen success.
I think one of the most important things, especially from a scalability perspective, is absolutely cross-functional. So involving, a communication strategy is extremely important. Where are you going to hit? What's the, how do we get to people out, across the United States and Canada? And a communication component to that is really, really important, about the resources, about what tools are available, and whatever that platform is for you. Ours at Associa, it's a very robust communication platform, so we were fortunate, but it's ongoing, and it's part of, like I said, the conversations and the workflow and how all of that works. So I would just say a really solid communication strategy is one way that I've seen us be able to reach masses of individuals.
Yeah, super intentional there. Other thoughts about, and I know a lot of these companies are sizable, any other thoughts about the challenges of a large organization?
Yeah, I think when an organization is large, you can no longer move people directly. You have to move people through other people. And so if you do something like start a call by asking everybody what they're grateful for, then the people who are on that call might take that idea and do it on their own team calls. And so this idea of empowering by modeling and empowering by giving examples of how other people can lead. And I can't believe you said that, because my CEO starts every single Monday morning call with, what is everybody grateful for? Mm-hmm. And I started doing that on my team calls, and I just learned 2 days ago that one of my direct reports organically started doing it on her team calls, and I had no idea. And but it started with my CEO 2 years ago doing that. Mm-hmm. And you just really don't know how that can impact people if you focus on this concept of moving people through people. So a little fuzzy, but it's an example that I can
it's
give
for
you.
most things. I mean, that's how we move people is through people. And sometimes I find it's important to be intentional, because so he's giving a great example. When I leave that meeting, I might just go forget about it. So I like to be more intentional with my employees. If there's anything that's working for you, I would encourage you to,
repeat it.
Go to your teams and, if it felt good for you, don't forget about it when you leave, because somebody else can feel good about it from you.
Totally.
I'm going to add something very quickly, because true story, and you probably think we're making this up. My CEO asked me, how are you doing? Very simple. And I went straight into, I did not answer his question, and I started going straight into my needs, his desires, what we can do, what we can't do. And I noticed a blank look on his face, and I'm like, is he catching up? I mean, I'm not talking that fast. Let me slow down a little bit. What's happening? Come on, work with me. How many cups of coffee did I have? And as soon as I stopped talking, he very intentionally said, how are you doing? And my heart almost fell out of my body, because I was so caught up in the work that I didn't even hear. I walked right over it. And a lot of leaders, if they're not intentional, could easily follow me down that yellow brick road, and next thing you know, and it was just a beautiful example of not just doing it, but being intentional about doing it.
Yeah, great thought, and I'm glad to hear those leaders are starting off that way. They probably attended a From Day One conference. I assume that's where they learned that. Not sure, but probably a good chance of that. So we got a couple more questions. Elena, we're going to start with you on this one, and if anyone else wants to chime in, that'd be great. You mentioned earlier you've had some pretty strong success with engagement, but what are the biggest challenges employees face when they're considering just participating in a wellness program? Probably a big question on all of our minds. And where have you seen success happen in overcoming those challenges?
Yeah, so one of the challenges that nobody knows about it, which is a marketing problem. The other challenge is they know about it and they're still not using it, which is a design problem. So that's either it's too confusing, they don't understand where to go, the cost to use it is too high, it's too difficult to use, there's barriers between them and the action. When we think about outcomes specifically, historically, the concept of what is a success has been pretty fuzzy. We're very specific in that at First Stop Health, we think about success when a patient has formed a relationship with a care provider, because that's really, for us, the beginning stages of a better health. So whether that's a primary care physician and someone's gotten their preventive exams as a result, or they've created a relationship with a counselor. And so outcomes for us is a direct function of new habits created and new relationships with care providers created. But I will tell you, sort of what I spoke to earlier, so much of kind of creating that success is understanding what makes a human being create an action and then targeting that action.
Yeah, good thought.
I just add, I think organizations often look at these wellness initiatives as, as the economic value of those, right? And, at least we haven't seen those pull through, which is not the point, right? Which is when we look at claims data at the end of the year, we don't see a market difference between an investment in wellness programs and our claims data. And if you stay focused there, then this becomes a secondary effort or something easily cut, as compared to part of a culture, part of who we are, part of what it means to be a caregiver is taking care of our employees as well. And it's not a financial, just a financial pull or a financial play. The other side, I think, is organizations tend to be penny wise and pound foolish. I referenced my own personal journey at the start when I worked back at Concentra. But we had wellness teams that competed in this. It was once a year in a major challenge, and then a mid-year in a minor challenge. But if you won, you got half off your medical, the whole team, half off your medical benefits all year. If you were in the top 10, you got a quarter off. And it was meaningful. And there was a lot of buzz, and people, were talking smack to each other during it, and people would be calling each other and going, "What are you eating?" And they go, "Well, I'm eating ribs." And they go, "What the heck are you doing, man? Get a salad. Come on." And it was that type of energy, and maybe public shaming isn't the best practice here. But even we were talking. Former CHRO at Associa was at Concentra with me, and we were on the same team. And she's like, "Greg, I am not getting on the scale in front of you every week." But it was that type of fun. But it wasn't just about making money. It was about, a caring about people to get better and get healthier. And the stories were shared every week in every meeting about people who are off drugs now because of their weight loss, or were running or doing other things.
We call that positive peer pressure, not public shaming.
Yeah, that's a better phrase.
Right. We got a couple more minutes here. I'm going to put our panelists on the spot, but they knew this question was coming, so it's on them. No, I'm just kidding. But I want you to leave our audience with one piece of advice that you can offer, something for our audience to take back with them as they head back to their jobs. I don't know, somebody want to start? Someone have one ready to go?
I've got one, and it's a cheat that I've used for years. I want you to think about the leader that you answer the call at 5 p.m. on a Friday. Get that leader in your head. And then I want you to think about the characteristics attached to that leader. I want you to write them down. They're all going to align with emotional intelligence. I already know, test it. And then I want you to mimic those characteristics. Just that simple. 5 p.m. on a Friday.
Gotcha.
So mine is really simple. I think first and foremost, be authentic. Be intentionally authentic. Be yourself all over. And then the second thing is to extend grace.
Like that. Elena?
I will share, so I've had my life changed from a leadership coach, and I do not say that lightly. And I'm going to share a piece of, I'll call it a piece of language that he gave me, which was, he references this concept of being above the line or below the line. And when you're below the line, you are thinking from a place of scarcity, fear, concern, there's not enough, worry. When you're above the line, you're creative, open, there's abundance, you're joyful, you're in play, and it's the same situation you're engaging with. It's just recognition of if you're reacting from below the line or above the line, and just adding words to something like that has kind of fundamentally changed how I've dealt with my own career and my own life. So you can Google this if you want to, but it is it's something that's really changed how I think about the job.
It's in the Oz principles.
Yeah.
And it's really helpful. My team uses it too.
Yeah. It does do good work.
It does do good work. I would just say, when or to whatever extent for which you're comfortable, be vulnerable yourself. Let people see you and feel you. If it looks like your life is perfect, and my life is not, you get it. And be a student of well-being and encourage leaders to get some resources for themselves and how to better understand how to manage with that.
Yeah, I think personally around wellness is, I don't tend to be, I tend to be more kind of gruff, like, how hard can this be? And my kids have taught me a lot about, wellness. They've taught me a lot about not only being a better leader, but being a better parent around slowing down, thinking about things. And I think we need to think through that as well, that the whole notion of well-being and wellness doesn't just stop when I leave work, and how I take care of others. And, a lot of us in this room, probably grew up in a different generation where it was like, My dad used to say, what the hell's work-life balance? If it was fun, they wouldn't call it work. And you go, but the folks coming up in the world, like, well-being isn't an option, it's a requirement. And if we're going to be competitive at all, we're going to have to meet them there, regardless of our age or our generation. And I just think I've become, as part of this journey, I think a better leader, but a better parent, around these areas.
And that made me think above and below the line. Also a good way to conversationalize. The feelings of where I'm at right now is a mood elevator. Like, where's your mood elevator at right now? Like, I'm like 3 floors down. Okay, this is not the best time for that. Just making it more light than how are you? It can really just be like, where are we at on the elevator? 3rd floor, let's go. I got to talk to you about this thing.
All right. Let's give our panel a hand for us. Thank you all. All right, well, thank you all, and may we all be above the line for the rest of the conference.